And now at 4, a frightening moment on the court. LeBron James' son, Bronny, goes into cardiac arrest while practicing at USC. The James family says Bronny is recovering after that health scare, but this is understandably has fans shaken up.
That's right. This latest incident comes just months after NFL player Damar Hamlin nearly died on the field after suffering a cardiac arrest. We have team coverage on the scary moments at USC. Michele Gile is speaking with the doctor, but first, Jim Hill joins us with more on what happened and an update on his condition at this hour. Jim?
And of course, we want to wish him the very, very best. That is for sure. But according to a statement from a James family spokesman, 18-year-old Bronny James collapsed and suffered cardiac arrest while practicing with the USC basketball team. As of this hour, Bronny is in stable condition and still recovering in the hospital. James is the eldest son of the Lakers star LeBron James and is entering his freshman season with the USC basketball team, where he is part of a highly touted freshman class. The Trojans were granted extra practice days in order to prepare for an overseas exhibition tour in Croatia and Greece. The team is scheduled to depart next week. James played high school basketball at Sierra Canyon in Chatsworth and was a member of the 2023 McDonald's All-American team. And I spoke with a couple of LA Times writers this morning to get their thoughts.
I've been around long enough to remember Hank Gathers and what happened tragically with him at Loyola Marymount. So I think in Los Angeles there is a heightened awareness of young people, and when they have these kinds of health issues, especially when it happens on the court, we're reminded of that. Obviously we've come a long way, I think, since then, medically and everything else. So I think everyone's just happy that he got to the hospital, and everyone's thoughts are with him and the James family.
Obviously, this was kind of a, potentially transformative signing for USC to get Bronny James into their program. But I think before any of that, first, I read somewhere that he's in stable condition, so that's kind of positive, and hopefully he's on the road to recovery. But I think that's kind of the first thing we want to think about here is just the kid's health.
And we will have more reaction to this story coming up a little bit later on in sports. Leslie?
Jim, thank you. There are many cases where young athletes have suffered cardiac arrest. KCAL News reporter Michele Gile spoke with an Orange County cardiologist to get more insight on these frightening medical emergencies.
Orange County physician Jeffrey Tyler is one of the hockey team cardiologists for the Anaheim Ducks. The medical emergency Bronny James had on the basketball court, according to Tyler, is as serious as it gets.
Overall, athletics is good for the heart, and I don't want that to be lost in the narrative here. However, if you have an underlying heart condition, during exercise, you can have an event that leads to a sudden cardiac arrest or a cardiac event. And the reason for that is there's lots of stress on the heart. As you're exercising, the heart rate comes up, the blood pressure comes up, and these things can precipitate a heart attack or other heart events.
Dr. Tyler doesn't treat Bronny James, but he has cared for other athletes who've experienced cardiac arrest playing sports. In some cases, he says, those patients were born with conditions which cause the heart to stop. Yet there are other causes, such as the chest trauma NFL safety Damar Hamlin survived last year. Hamlin tweeted this after hearing of the emergency at USC. Prayers to Bronny and the James family as well. Here for you guys, just like you have been for me my entire process. According to Dr. Tyler, the most challenging question in sports cardiology is whether the athlete returns to the game.
On one hand, you have a young man who has a bright future, but on the other hand, you want to keep him or her safe going forward. So a lot will come out in the coming days, weeks, and months as he undergoes a cardiac evaluation to understand what the cause was. There's a variety of causes that can lead to cardiac arrest.
Dr. Tyler's biggest message to coaches or bystanders who may see someone collapse after cardiac arrest: do an immediate assessment, he says, give CPR and/or use an AED, and call 911 right away. In Orange, Michele Gile, KCAL News.